Hello everyone, today here is Arin Usama and this video will demonstrate how to give the medication directly in the vein with an infusion or PVAD short.
Hi Renee.
Hi Wendy.
What are we up to today?
So let's show students how to give an IV direct medication into a PVAD short that has an infusion going.
Okay.
Okay, so of course you've done your assessment, you've made your decision about which drug to give, what dose, route, patient, time, all that stuff. You've gone, of course your hand hygiene's part of it, you go to your medication dispensing system, you take it all out according to your policy, and then you prepare it with all those principles that we've talked about before. So I have my medication ready. I have my flush ready. I brought my MIR to the bedside. I've done my 2 patient identifiers, and all is well. Okay, I've informed the patient what I'm going to give them, and if there's anything I need them to be on the lookout for, I've informed them about that. So first thing I want to think about is, so when I prepared my drug, I had to look at the drug monograph. So in our health authority, we have a parental practices manual, which gives us all kinds of great information about what is the drug, what are the common side effects, how can we give this drug IV? Do we push it or give it direct? Do we put it in a mini bag? What kind of volume? What kinds of things do we need to look out for? How fast can we give it? So in this case, I am giving morphine. I can give it over 2 minutes. Okay, so, and I've had to look at compatibilities too. So now I have an IV solution running. I also have a mini bag running as well, so I have to make sure that this drug is compatible with this solution and this solution. So if everything's compatible, I can go ahead and push. If things aren't compatible, then I have to stop something. And what I have to think about is, where am I going to, where's the port that I'm going to inject it, and I can have nothing coming behind it that's going to potentially contaminate.
Okay.
So that happened to me one time in practice. I thought I had flushed the lines adequately, and I hadn't, and I could see the crystallization in the tubing happen really quickly.
Oh yes, like it's snowing, right?
Yep. So I had to shut it off, run, get some new tubing and bag ready, and disconnect it. Actually, I disconnected it right at the patient because I didn't want to risk any of that particulate getting into them, because I would imagine that it was a snowstorm in here. I don't know what it would have done inside the patient. All right?
Okay.
All right, so compatibility is all good. You find the port closest to the patient, which is this one this time.
Do we have to worry about the rate here? Because this is going pretty slow.
Yeah, I'm going to do that in just a sec.
Okay.
Good question. All right. So the protocols tell you to flush before and after you give IV meds. Some nurses will default to say, this is my flush before and this is my flush after. So again, it's going to depend on your rate that you choose, right? So this IV pump has a feature called bolus, so I'm just going to stop it, and I'm going to run a bolus of 40 mils, and I'm going to run it over, I know the drug's going to take me 2 minutes to push, plus I'm going to give it another minute, so I'm going to put it in over 3 minutes. Press OK. And here we go. And you can notice that the sound changed.
Yes.
And that's because the IV is just running a little bit quicker. So we're bolusing now. That's our pre-flush.
Yeah.
Okay. Now I'm going to take my medication. I've cleaned my port, 15 to 30 seconds. And I'm going to just push this over 2 minutes.
Now I've seen some people, some nurses, instead of using the bolus feature, that they'll just increase the rate.
Yep, you could do that. The good thing about the bolus feature is when the bolus is done, it will go back to the original rate.
Yeah.
If you just increase the rate, which isn't wrong, but you forget to come back, then the patient could receive a bolus.
Yes.
Yeah.
Like the whole thing.
Yep. Or likewise, if you don't.
So it's a safety thing. You should be using the bolus.
Yeah, and if you're running your IV with gravity, you would just simply open it up and increase the rate. Always thinking about the patient, and is increasing the rate going to cause them any harm?
That's right.
So if they have a history of pulmonary edema, heart failure, renal failure, you have to be really careful with how much you are going to bolus them with. Okay, so our time has lapsed, the drug is in, I've disconnected, and now we still have 15 mils that is going to bolus in and do our end flush.
So what would we do if say the secondary medication was not compatible. How would that change what you did?
Okay, so then I would have to think about what is this medication? Can I temporarily stop it while I push my med and then restart it or not? So let's say you could temporarily stop it. So you can simply clamp your secondary line.
Okay.
Okay.
And then do we worry about what's in here?
Yes, you do. So then you're going to run a bolus to flush this out. Then you're going to give your drug, and then
Bolus it
it again, and then restart
Start that.
your medication that's incompatible. Sometimes patients have additives to their IV that in the primary bag that are incompatible.
Yes.
In which case I'm just going to stop this. If the primary solution is incompatible and you're running multiple IV meds, and it's really important that they receive whatever the additive is in there, let's say it's heparin,
Yeah.
you'll just go start another IV site,
Okay.
just for IV purposes.
I hope that you get benefits from this video, and thanks for watching.